thank you for your attendance today. Our group, OLA, standing for County of Los Angeles Online Appointments, has evaluated online public service appointment scheduling for LA County residents. OLA is the way. Our diverse team is composed of representatives from 5 county departments. I am Kira Barnett from Public Works, and we also have Armine Tellien from Department of Health Services, Brian Wells from the Fire Department, Ruel Garcia from the Sheriff's Department, and Whitney Duong from Animal Care and Control. OLA is the way. In late 2019, COVID-19 emerged, resulting in the recommendation that people minimize physical contact to reduce the spread of the virus. In March of 2020, most county offices closed to the public. As a result, many employees have been teleworking to allow for adequate social distancing in offices. Since the pandemic and changes due to COVID-19, there's been a reduced ability to have in-person interactions, but the need to provide our services to our customers still exists. Services have primarily moved to online and over the phone. Some constituents do not have are not comfortable or have the ability to do business by these means and want direct connection with our people and services. Customers of the county do not currently have access to the ability to schedule meetings with personnel from some of our departments. OLA is the way. To access employees, constituents often must leave a message or send an email to request a callback, as some employees are not taking direct calls. Voicemails and emails require some lag time for county employees to respond. Many constituents have found themselves extremely frustrated with the options available, as they desired instant communication or connection, and that's not available. Providing an online public service appointment scheduling option would allow constituents to schedule an appointment or a virtual meeting with county staff at a predetermined date and time. Here are Whitney and Ruel to share a scenario to demonstrate OLA in action and ask you a couple of poll questions.
Thank you, Kira. I just lost my job and have submitted my paperwork to get medical insurance, but not sure if I could afford a babysitter to drive to DPSs and wait in their long lines to follow up on my insurance status. Wait a minute. Roel mentioned to me that there is an online appointment system called OLA. I can set an appointment to speak to an agent of any LA County department if I have any question. I will give it a try. Type. Hello, my name is Whitney. I want to follow up on the status of my insurance. Case number 123. I would like to set an appointment to speak to a case manager. Is OLA the way?
Hi, Whitney. This is John with the Department of Social Services. Thank you for contacting us using the OLA system. Can I set an appointment for you?
Hi, John. Do you have an online appointment for this Saturday at 2?
Saturday at 2 o'clock is available. Would you like me to set it for you?
Yes, please, John. Thank you. OLA is the way. Now we have 2 poll questions for the audience. First question, how many of you have used an online appointment system? The follow-up question is, if yes, was the online appointment system for private industry or government?
We'll give you a few more seconds and look at the results. And the results are in, and 97% said yes, they have used an online appointment system, with 3% no. And question number 2, 66% in private industry, 25% in government, and 9% unsure. This proves that definitely OLA is the way.
Great, thank you all for participating. Great to know that most people have used an online appointment system. I know I did for scheduling my vaccine. So that was my recent online appointment example. OLA is the way. After the current crisis subsides, continued problems with providing county services in person include our large geographical area, traffic congestion in getting to our offices, finding and paying for parking, and long lines. Long lines create an unpleasant customer service experience. From my personal experience, I can vouch that wait times to access services in our building department used to routinely exceed 2 to 3 hours. OLA is the way. It is our evaluation that online appointments will serve a need while COVID-19 response continues, and that there'll be benefits beyond the current crisis. Private business has been moving to incorporate online appointment options, including in the medical, legal, and other fields. As 21st century industry partners, it will be an ongoing benefit to provide another meeting option for LA County residents. OLA is the way. A survey of more than 3,000 US citizens showed that 85% of constituents made it clear that they expect the same or higher quality from government digital services as they do from private or commercial organizations. OLA is the way. For out of town or traveling constituents, online appointments and scheduling allow them to keep up with their county business while on the move. Also, many consultants may be based far from a servicing department, and online appointments may best fit their needs. Some meetings require coordinating many individual schedules, and arranging an online appointment at a set time may make it easier for groups to meet together. Providing an online appointment option increases our ability to provide services in an equitable manner, adapting to our community needs. Now I will turn it over to Brian Wells to discuss our project plan.
Hi, I'm Brian from the fire department. Our team worked to identify the issue. Was there a problem meeting with county employees when most are working remotely? We discussed personal experiences with this issue and concluded there was a problem. The problem wasn't that the work was not being completed, but establishing a time to meet with county employees to discuss specifics of a concern was the issue. We discussed and researched solutions to solve the issue. OLA is the way. A questionnaire was used to set a baseline. What is used out there? And is there any one product that will have an advantage over the other? OLA is the way. With only 5 of the county's 34 departments represented in our group, we sought additional input from members of our cohort and external agencies by the way of a questionnaire. The questions focused on the software that was used, were there integrations with virtual meeting platforms such as Teams or Zoom, determining how a customer would get to the correct department, user feedback and reception, any additional equipment needs the department might need to purchase, and the overall results. That is, did the customer's experience improve? The full responses are located in the appendix of our paper. OLA is the way. The responses were varied, and the simple yes or no answers are listed here. With some of our departments, our group suggested that they did not need an external facing appointment system as they primarily dealt with internal stakeholders, while others definitely needed an external facing system that would deal with constituents as customers. And they would benefit the most from a system such as OLA. Additionally, we determined there may be circumstances when a customer may need or want to speak with 2 or more departments simultaneously to accomplish their county business. OLA is the way. The software versions used was compiled and the options were reviewed. While Acuity was selected by 3 of the departments queried, Microsoft Bookings was a close second. The availability of Microsoft Bookings, as it is part of the Office 365 suite that many county departments already use, became a front runner. OLA is the way. Of importance to note is the reason for the system to solve a problem. It would not be beneficial if the county employee were the one to set the meeting time between 2 and 2:30 if the customer was not available during that time. We feel that the customer should be the one who sets or requests the time for the appointment. County departments may need to shift their work schedules of their employees to meet the customer's needs, but responsiveness to the customer is what will improve the overall experience. And shifting work schedules may not be entirely bad. Many county employees may seek modified work schedules to be able to assist their children who are homeschooling because of COVID or elderly parents with their own appointments. OLA is the way. Ensuring all customers of the county have access to the service we provide, the system will also allow for the ability to make regular phone style appointments. The OLA system will not supersede the customer's ability to connect with the county by phone, but provide another option. In-person, phone, and online will be the methods any constituent can seek service from the county. For example, an architect in another country working on a project for a resident of the county will have a much different need than a person seeking assistance in dealing with an elderly relative. Keeping the system as diverse as the county is key. OLA is the way. Finally, implementation. The system will not be closed. That is, once it's implemented, it won't be looked at again. It will need to grow and contract with the needs of the county's customers. It will be fluid, constantly reviewed, and improved upon. Following the directive from the board to implement OLA, and after a reference vendor is selected, each department will have the opportunity to tailor the way they use it keeping in mind the team concept and the ability to approach an issue. A definition of duties will need to be refined to ensure that each department and each employee would know what they would be working on as an appointment was requested. You would not want a public works engineer that reviews a water system to have the final say on a building plan. Now with a review of case studies, here are Whitney and Roel.
Thank you, Brian. The first case study is from Department of Animal Care and Control, DAC. In late 2019, COVID-19 emerged, resulting in the recommendation that physical contact between humans be minimized to reduce the spread of the illness. In response, in mid-March 2020, most Los Angeles County Department had to close its doors to the public, and many employees shifted to working at alternative work locations. The pandemic forced DAC to quickly make necessary changes to normal business practice to protect the public, staff, and volunteers. In mid-March, DAC immediately shifted to appointment only for the public to visit the care center to allow pet adoptions to continue while maintaining physical distancing. Since the implementation of the external customer online system, DAC has been scheduling pet owners for vaccination, providing counseling for pet retention, fostering animals, to name a few services. DAC schedules the appointment on Acuity from our website. If a department like DAC with a limited budget and personnel of 350 employees serving 3.5 million residents can implement an online appointment platform within a few months, then most LA County departments should have the capacity to do the same. The remaining county departments are recommended to evaluate the benefit of COLA OLA. Now we have Roel to provide the next case study. Take it away, Roel.
Thanks, Whitney. Hi, I'm Roel with the LA County Sheriff's Department. Currently, LASD has over 15,000 inmates in our jail system. In order for family and friends to visit a loved one in jail, they would have to pay for parking, scramble to find a parking spot, and physically stand in line outside a visiting center. Sometimes these lines can grow long, up to 200 people, waiting for a 15-minute visit. Sometimes only to find out they can't visit their loved ones for one reason or another. The implementation of COLA OLA would help with scheduling these visits in an efficient manner and provide family and friends the assurance of a pre-scheduled visit. In our patrol stations, the implementation would help with station counter reports. On any given day, our patrol stations take dozens of counter reports all over the county for things such as traffic accidents, property crime reports, identity theft, and other types of crime. Currently, residents show up unannounced at a patrol station requesting a written report. This requires patrol deputies to be called in from the field, removing a deputy from the patrol environment. Depending on what is occurring out in the field, a resident can wait several hours for a deputy to respond and write the report. This is a very serious problem in LA County. COLA OLA would alleviate the wait time, allowing LASD to provide resources needed based on an appointment calendar. COLA OLA is the way. And now I'm going to turn it over to Armene for a cost analysis and pros and cons.
Hi, everyone. So due to the nature of the ELDP program, in-depth cost analysis is not feasible. However, we believe a singular effort from all county departments will be efficient, cost-effective. Consistent implementation would benefit our shared county customers as they would not have to learn different systems and procedures. So there are some consideration, of course. Any program we start, there are some consideration. Securities and privacy concerns for one, particularly with regards to personal information and medical protections. Once our offices reopen to the public, coming up June 15, we're going to have a hybrid programs, isn't it? We're going to have an online appointment and in-person appointment. That can be challenging, especially with the staffing. Another challenge is desire of our customers to have in-person appointment. For example, when I was interviewing our treasurer and tax collector team, they were telling me that they have some customers who would like to come to the building to pay their bills. For example, their property bills, isn't it? Property taxes. So That's okay. They are welcome, because what happens, the most of our customers will be using an COLA OLA. In that way, these customers will not be waiting in a line. Another one is availability of devices and high-speed internet. Yes, that's a problem. However, I want to tell you, this gap has closed within the last 15, 16 months. Because of the COVID, a lot of organizations, including churches, schools, gave away some tablets, smartphones, even help with the high-speed internet payment. So that becomes a benefit as well, because we have closed the gap so much that we have more and more in a population of customers using system technology. So let's look at the benefits. I know my teammates, my friends discussed so many benefits already. For example, if I am the person who is taking care of coming to LA County for schedule, what I can do from the comfort of my home, I can make my appointment. If I have to fill some kind of a paperwork, I will fill it and submit it. So then the customers, internal customers and external customers can taken care of already, because our paperwork is done, we scheduled our appointments, and everything is nice and dandy. What about the languages? We know we live in LA County. It's a diverse patient and customer population. So we are predicting that COLA OLA will have so many different languages, so that it will make our customers more adapted to the system to be used. And then there is the technology again, internet and tech savvy customers. I don't know about you, but I braved out and went out to restaurant. When I went to restaurant, I was thinking, oh my God, everybody is going to just sit down with their friends and family into each other's face and talking. That didn't happen. They were all on their cell phones and then typing away. Okay, I thought to myself, that's to our advantage. We're discussing to implement COLA OLA. That's it. We're bringing technology to our customers. So that is an advantage. What about the other of us? For example, I am from Department of Health Services, and I got this data from Department of Health Services, Office of Patient Access. What do we see in here? We see that during this fiscal year from July 2020 to April 2021, DHS has received about 120,000 and more than 190,000 calls per month. That's a lot of calls. We receive all the way up to 22 types of calls, including our making, breaking appointments or virtual appointment requests. I can tell you more than 50, even sometimes 70 to 80% of those calls are for appointments. So imagine what COLA OLA will bring to our patients. They will not need to wait such a long time for our agents to answer their other 21 types of questions. So that's such a big benefit. And now let's look at the other graph. And I am not very proud of it, but I want to share it with you. Average wait time for the DHS patients. So you can see it ranges from 2 minutes to up to 5 minutes. That's a lot of time. To tell you the truth, the DHS has a goal of 2 minutes, at least less than 2 minutes. And our Board of Supervisors actually wants all LA County departments to respond to their calls in 30 seconds. So we're kind of far away from that 30 seconds, but with the implementation of COLA OLA, we'll cut that time, and I'm sure we'll get to there. So you would ask me, so Armine, what is your team's recommendation? Our recommendation, actually, first of all, I want to share you with our vision. Our vision is 211la.org to link the customer to the individual department. and for each department to have an online appointment option housed in their own webpage. It is our recommendation to have an LA County department utilize the same platform for online appointments. Based on our research and the fact that LA County has Microsoft license, one software that we, like Brian stated earlier, recommend and suggest is MS Booking. No added cost or third-party vendors anymore because we already are licensed with them. It is a program that allows departments to integrate on their webpage an online reservation system. There are many ways to customize the experience depending on each department's needs. This system is intuitive and its flexible design makes it equitable and easy to use to fit our LA County external and internal diverse customers' needs. So now that you heard about Pulse Across and our recommendation, I want to pass it to Whitney with another question. Whitney, the floor, the screen is yours.
Thank you, Armene. Please turn your camera on or with the reaction icon of thumbs up or down for the last poll question. Do you think COLA OLA is the way? OLA is the way. Now here is Roel with the final comment.
Thank you, Whitney. In closing, the implementation of COLA OLA is about showing respect for the residents of LA County, respect for their time and their health. When a resident arrives at a county department office, they want to feel respected and valued. Residents want to know their tax dollars are being put to good use, so they expect prompt service and high quality assistance. Long lines don't communicate that. It's actually the opposite of respect. By eliminating the need to wait in physical lines, COLA OLA demonstrates respect for all LA County residents. Instead of forcing them to take time off of work, scramble for parking, wasting valuable time sitting in a crowded waiting room, COLA OLA acknowledges the customer's time is important. It allows residents to take charge of their own schedule, arrive at their appointment only when they can be helped, rather than wasting valuable hours waiting for a free employee. When residents feel respect and that they're being respected, they're much more likely to respect the employees helping them, improving the overall mood within Los Angeles County agencies tremendously. COLA OLA is the way.
Thank you, Roel. Group 3 of cohort 33 would like to thank DHR, ELDP instructors, coaches, coordinators, classmates, and teammates. OLA is the way.